Hello everybody, I'm Mike from SurgTech Academy, and today we're going to talk about OR attire. Now, what I really hope to accomplish with this video is for you to recognize appropriate OR attire and to be able to distinguish between basic and accessory attire. So let's start with basic operating room attire. The most basic attire are scrubs. Scrubs are provided by the hospital. Make sure they're clean, tucked into our scrub bottoms, or at least tight fitting. Next, let's talk about hair covering. There are three main hair coverings. The first is a surgeon's cap. Here I have a disposable surgeon's cap, and I do have a cloth cap that many people are wearing now. I prefer the bouffant the best. It covers all my hair, covers my ears, and covers my sideburns. Then lastly, we have the surgical hood. With those of us that have beards or those that are doing No Shave November, the surgical hood is the best option. Next, for basic OR attire, I want to talk about shoes. There are many styles of shoes: running shoes, trail shoes, clogs. Pick whatever you want. The main thing is they need to be clean, dedicated to the operating room, closed toe, and closed back. Make sure to check your hospital policy, but students, wear your shoe covers at all times. Next, let's talk about the warm-up jacket. Obviously, the warm-up jacket needs to be long-sleeved, completely snapped with the name tag on the jacket. I personally don't like name tags on scrubs. I think there's a potential for contamination on the surgical scrub. And then lastly, as part of our basic OR attire, we have the mask. Make sure that we have the dark color to the outside, the metal insert fits around the nose, and it fits tightly around the neck and the dome of the head. And that's it for basic OR attire. Next, let's transition to accessory attire. The first thing is the lab coat. Mainly, we use the lab coat whenever we leave the department, and I think that's about the only time we use the lab coat. Eye protection. Use goggles with side protection. Maybe something like this. If you have eyeglasses, you can use these side plastic eyeglass inserts and put them on the arm of your glasses. Those big heavy-duty goggles are okay, but I find them to be super uncomfortable, especially for long surgeries. And that's all I got to talk about for accessory attire. Next, I want to talk about restrictions just for a couple of minutes. All right, the first thing are tattoos and piercings. Tattoos and piercings are a hot topic right now. Tattoos are accepted, but be aware of healing times on new arm tattoos for scrubbing purposes. Piercings. At SurgTech Academy, it's just easiest to say no piercings are allowed. No ear piercings, no tongue piercings, no nose, no eyelid, no cheek. AORN says ear piercings are okay as long as they're covered with the bonnet. Next, cell phones. Make sure you disinfect your cell phone before and after being brought into the department. Make sure they're on vibrate or silent, and students only use them during lunch. I found that the best way to disinfect a cell phone is just to take a little alcohol pad and wipe down the front and the back of it. Next, for restrictions, I want to talk about undergarments, such as t-shirts. T-shirts need to be contained within the scrubs, but make sure you check hospital policy if undergarments such as t-shirts are allowed at all. Students, I think t-shirts are okay as long as I can't see them. Jewelry. Woo. Absolutely no jewelry on the hands or jewelry that can't be contained in the bonnet or the scrubs, such as a necklace. Here at SurgTech Academy, we just think it's easy to say no jewelry, and that's kind of the standard. Next, nails. Unchipped nail polish is acceptable by AORN, and they say that the magic number of days is 4 days before nails start to chip. But again, I think it's easy just to say no nail polish. Lastly, hygiene and perfume. I think the easiest thing is just to say shower and use deodorant. There are many great body sprays out there, but there's so many patients with allergies, it's just best no perfume, body washes, body sprays. Well, I think that's it for OR attire. I want you to have a great day in surgery, And remember to be a superstar in your OR.